Hello, my name is Cindy Traffenstedt, and this is my ground rounds on pulmonary fibrosis. Hello, my name is Cindy Traffenstedt, and this is my ground rounds on pulmonary fibrosis. As many of you already know, my mother was diagnosed with pulmonary fibrosis about 2 years ago, so this condition or disease process is very near and dear to my heart. Pulmonary fibrosis is a chronic lung disease that causes scarring in the lungs and makes them become hard and stiff. The cause is unknown, but linked to cigarette smoking, GERD, and environmental issues and hereditary. Pulmonary fibrosis is a chronic lung disease that causes scarring in the lungs and makes them become hard and stiff. The cause is unknown, but linked to cigarette smoking, GERD, environmental issues, and heredity. In the United States alone, prevalence was estimated to 42.7 per 100,000, which means you're more likely to have pulmonary fibrosis than cystic fibrosis or ALS. Still, pulmonary fibrosis is relatively an unknown condition. Still, pulmonary fibrosis is a relatively unknown condition. The scar tissue causes marked loss of lung compliance, and the lungs become stiff and difficult to ventilate. Even though the disease can be diagnosed in children and infants, pulmonary fibrosis affects mostly middle aged adults and older age adults. Men are more likely to develop pulmonary fibrosis than women. Generally, they're diagnosed 50 to 75. Idiopathic pulmonary fibrosis, precise biological mechanisms underlying the development of pulmonary fibrosis and irreversible lung destruction remain elusive. It is the formation of fibroblastic foci and abnormal accumulation of extracellular matrix that cause the problem. There are several ways to diagnose pulmonary fibrosis. Generally, a bronchoscope will take a small tissue sample, and that's generally how it's diagnosed. But also the bronchoalveolar, where they inject solution into the lungs and then draw it back out and use that in the lab to sample and view the cells, is also another way. Throughout the process of pulmonary fibrosis, they also do chest x rays, CT scans, pulmonary function testing on a pretty regular basis, like every 6 months, and then obviously checking the O2 saturation as well. The number one medication for pulmonary fibrosis is a corticosteroid like prednisone. Sometimes they also add methotrexate, and there are two new medicines that have just come on the market, pirfenidone and OFEF, which are not cures, but they seem to show through research that they can slow the progression of the disease. Corticosteroids are always used with a pulmonary fibrosis patient. Sometimes they add methotrexate, and new medications have recently come on the market, pirfenidone and OFEF, which do not cure pulmonary fibrosis, but they do help slow the progression. So the medical community has definitely been excited about these two medications. They're game changers for the pulmonary fibrosis patient. Of course, all pulmonary fibrosis patients wear oxygen, generally 2 to 4 liters by nasal cannula. Promethazine is always ordered. All the mucus causes a lot of upset stomach. They always have the emergency albuterol, as well as the breathing treatments through the nebulizer. They usually will take a long acting inhaler such as Spiriva, a preventative antibiotic, and always treat for GERD. They always treat with Nexium, 40 milligrams per day. As far as any complementary medications, those are not approved or recommended at this time, so those are not used. Goals of treatment. We have medicine based treatment, symptom based treatments, which we have reviewed both, and also end of life care, which is palliative care or hospice care, which come in to try to help ease the pain and emotion of the family. For goals of treatment, we've already reviewed medicine based treatments and symptom based treatments, but we also have end of life care, which is palliative care, hospice, which will come in and try to ease the pain and make the patient as comfortable as possible and help the family through the end of life care. Some interventions as nurses that we can do to help. Some nursing interventions that we can do to help our patient is encourage them to cough and deep breathe. Deep breathing is so important for a pulmonary fibrosis patient. Oxygenation can be assessed regularly. We can educate our patients on the medicines they use and why they use them to help them. Encourage breathing treatments when needed and teach them to conserve their energy when possible. With pulmonary fibrosis, you always have serious complications with it. Hypoxia is generally the main complication. You also have pulmonary hypertension, right-sided heart failure due to the heart's lower right chamber has a pump harder than usual to move blood through, partially blocking pulmonary arteries. And then, of course, you have respiratory failure. This is often the last stage of chronic lung disease. It occurs when blood oxygen levels fall dangerously low. The lungs become stiff and it becomes more and more difficult to take a breath. The prognosis of pulmonary fibrosis is not a good one. Most patients only live 2 to 5 years after being diagnosed. Respiratory failure results from the disease progression and is the most frequent cause of death. Studies show that only 20 to 30% of subjects are still alive 5 years after diagnosis. Most patients experience deterioration over a period of the last 4 weeks before their death.